So, hello everyone. My name is Dr. Tu. I'm one of the hematologists. I currently work in Fredericksburg, Virginia. When I was in fellowship, we had a question before: how come myeloid disorders were not part of the PACT Act, and including veterans who are coming from the Persian Gulf War, the people from the Vietnam War, and also the Korean War veterans. So we tried to investigate why that is, and upon digging further, we realized the only the B cell disorders were part of the approved presumptive conditions under the PACT Act. So we investigated further in terms of looking at disorders, specifically myeloproliferative neoplasms, which is a clonal myeloid disorder, if it is truly associated with certain service-connected exposure. And we were the first one to actually elucidate that there is a significant association between Agent Orange exposure and the development of myeloproliferative neoplasms. And we actually investigated further into certain databases, such as the Vinci database, which is a huge amount of information in the veteran database, where we looked at the association with the development of myeloproliferative neoplasms coming from service-connected exposures. And what we found out is that there's a higher risk of the development of MPNs among Persian Gulf War veterans when comparing it to the Vietnam War veterans and also the Korean War veterans. And there's also a higher risk among those Vietnam War veterans compared to Korean War veterans. So this article has been published in American Journal of Hematology, and you can easily look it up. You just look at the risks of the development of myeloproliferative neoplasms among U.S. veterans, and you look up my name, and that's the article that it would show. What we also found out is that among those who are Persian Gulf War veterans, the age of onset is actually younger compared to the age-adjusted incidence among those who are in the healthy controls. So all of this is discussed in the paper, and we also found out that among those individuals, the veterans who are African Americans, they have a higher risk of thrombosis and bleeding events, and also decreased overall survival. And what's interesting is that the risks of age-adjusted incidence among Persian Gulf War veterans is actually higher compared to the healthy control cohort, which is discussed there. And what we're trying to get at is that this is like a step to get clonal myeloid disorders, or even myeloproliferative neoplasms, as part of the presumptive conditions to get these veterans benefits under the PACT Act. So the next step is trying to lobby for and get more data out there and encompassing the entire Vinci database, so further researchers can look into this paper and look at what the limitations we have and overcome those limitations, to include an entire veteran database and also a healthy control to actually prove that this is really a service-connected exposure associated or presumptive condition. So that in that way we will really get the veterans benefits in the long run.